Okay, so it looks like we're streaming live on YouTube. Good morning, everyone, and welcome to our media briefing. It is Tuesday, October 13th. Today, we're going to have an update from Dr. Hsiu-Li Wang, and I will also provide a very brief update about enforcement, and then we'll get to your questions. Before we begin, I just wanted to highlight that we're aware that there's been a heightened need with this being the second wave of the pandemic. To have more access to us and have more conversations with us. So we are going to reinstate the Friday media briefings starting this Friday at 11:30. So hopefully you'll be able to join us this Friday, and that will help you be able to get information from us and for us to be able to connect a couple times during the week. So that's it for my updates for now, and I'm going to turn it over to Dr. Hsiu-Li Wang to provide an update. Go ahead, Hsiu-Li.
Okay, there, unmuted. Good morning, everyone. In terms of overall trends, at this time, our growth has not accelerated at the same pace as some other areas in Ontario. Similar to other mid-sized regions in Ontario, however, we remain in a precarious state in Waterloo Region. As of this morning's dashboard update, there are 127 active cases. This number will fluctuate with the pace of growth of new cases. A total of 152,897 tests have been performed in the region, which continues to be a good number of tests performed every day. And there are currently 9 active outbreaks in the region. We have declared a new outbreak at Laurier University in residence at the Conrad Hall residence, as well as off campus. I'll provide more information about this outbreak a little later on this morning. We have an outbreak in a congregate care setting, 3 in long-term care homes, 2 in licensed childcare settings, and 2 in a school setting. So the only change there has been an additional long-term care home declared an outbreak. Some minor improvements to the daily dashboard. We have made some changes to our public dashboard under the characteristics tab. We converted our existing bar graphs for ever hospitalized, healthcare workers, and gender to epi curves, which show the changes of these characteristics over the course of the pandemic. The same information about percentages can still be seen when you hover over the graphs. Most cases among healthcare workers occurred during earlier stages in the pandemic, and overall there have been more cases who are female than males. However, in recent months, the proportion of cases by gender has been relatively balanced. Wilfrid Laurier University outbreak. Public Health has declared an outbreak at the university, both in residence and off campus. We have a total of 7 cases to date, which are linked, 4 of whom, 3 confirmed and 1 probable, reside at the Conrad Hall residence, and 3 of which, all confirmed, reside off campus. They are considered linked because all 7 likely acquired their infection participating in one of multiple study groups held off campus. All cases are being followed up by public health, and high-risk contacts are being advised that they need to self-isolate and get tested. Due to 4 cases, 3 confirmed, 1 probable, and other high-risk contacts identified on 2 floors of the Conrad Hall residence, these 2 floors have been declared an outbreak, and students living on these floors are being asked to self-isolate and will be tested. Of note, we are not publicly identifying the 2 floors due to a risk of identification of the individual cases. But all students who are impacted are being directly informed by the university. Public health will also be following up directly with them individually. Public health is recommending that everyone have close contact with those they live with only. For example, in their dorm or room only, and physically distance and wear a face covering with everyone else. The safest thing to do when studying together is to study together virtually. If you choose to gather in person, maintain strict physical distancing and the wearing of face coverings. Keep the gathering as small as possible. Use outdoor spaces as much as possible. There have been questions about Halloween. So our advice for Halloween is to stick to low-risk activities. Given that Ontario and areas including Waterloo Region have entered its second wave of COVID-19, Region of Waterloo Public Health supports the recommendation of Ontario's Chief Medical Officer of Health that people limit close, unprotected contact to only those within our immediate household. For events such as Halloween, it is recommended that Waterloo Region residents stick to low-risk activities. Ideas for celebrating Halloween safely with members of your immediate household include pumpkin decorating, virtual costume party, Halloween movie night, sharing spooky stories, or an outdoor trick-or-treat scavenger hunt in the backyard. The general principles are as follows. Limit close contact to people living in your own household. Virtual gatherings are the safest way to visit with people outside your household. If you choose to participate in or to hold an in-person gathering with people outside your household, you need to take the following precautions. Stay home if you have symptoms, even if they are mild or you recently had a negative COVID test. Physically distance and wear a face covering with anyone else outside of your immediate household. Regardless of the legal limits of 10 people indoors and 25 people outdoors, you should keep your gathering as small as possible, use outdoor spaces as much as possible. Gathering outdoors is safer than indoors, and the fewer the people, the lower the risk. If you choose to go out trick or treating, only go out with members of your immediate household. Physically distance and wear a face covering with anyone outside of your immediate household. Both trick or treaters and people handing out candy should wear a face covering, not a costume mask. A costume mask is not a substitute for a face covering and should not be worn over a face covering, as that may make it difficult to breathe. Do not leave treats in a bucket or bowl for children to grab. Use tongs or other similar tools to hand out treats. Do not congregate or linger at doorsteps. Line up 2 meters apart if waiting. In closing, the recommended measures of physical distancing, wearing a mask, washing your hands, and limiting close, unprotected interactions outside of your immediate household are going to be important going forward. We know that COVID spreads easily when we have close, unprotected contact with others. It means, and we have seen this many times, it spreads easily between loved ones or friends. I appreciate that many of you have remained committed to following the public health recommended practices. Thank you especially to everyone who followed guidelines over Thanksgiving weekend. Together, we can reduce the spread of COVID and keep our school schools and businesses opened, and medical procedures and surgeries going. Thank you.
Thank you, Hsiu-Li. I will provide a very brief enforcement update. We actually have not laid any charges, although we continue to follow up on any complaints or questions from the public. So that's it for enforcement. I will now turn it over to all of you for questions, and we can start with Damon from the Woolwich Observer. Go ahead, Damon.
Hello, my first question is for Dr. Wong, and it's about the Wilfrid Laurier outbreak in the residence. Will these students have to self-isolate, and will they be required to be tested?
Yeah, hi, sorry, I think you got cut off at the end there, Damon, but yeah, the students who are living on the 2 affected floors that are in outbreak will need to self-isolate for now.
Okay, and then about testing station, or sorry, my transponder is just going off here. About the testing situation, just 1 second. Can we come back to me? The phone's just going off in here.
Sure.
Yep, for sure. We'll move on to Nicole from CTV. Go ahead, Nicole.
I'll ask then about testing.
Sure.
When it comes to people testing for COVID-19, we are hearing of significant delays in getting the results, particularly for asymptomatic people who were alerted either by the app or need to get a test to visit loved ones or for work purposes. Some are saying, what is the point of waiting 8 to 10 days for the test results when they can also self-isolate for 14 days? You know, what's your response to this?
So I would refer you to the testing leads at the assessment centers, and you can connect with Lee Fairclough, who is the lead for the 3 assessment centers, in regards to questions about testing and turnaround times. But what I can say is that public health still recommends that if you've been referred for testing, that you get tested. And our understanding is that the testing backlogs, which have been an issue provincially, have in recent days become better. In other words, they have been reduced, and therefore turnaround times should continue to improve in the coming days.
To follow up with WLU, are you able to clarify what constitutes an outbreak? Because I've asked this question before, and you said you were still working on the protocol. So can you give us any set definitions before you declare an outbreak? And how many public health units are you currently working with as a result of this outbreak?
Okay, so I'll answer the first question. Generally, an outbreak is declared in a setting when you have a concern about the potential for further spread. And there's different numbers that have been identified, as you're all aware, for different settings during this pandemic. For post-secondary institutions, as is the case in general for workplaces, we and schools as well, we generally look for 2 cases, and we need to see a link between the 2 cases and a sense that spread could have occurred in that particular setting. In the case of the residence, Conrad Hall residence, even though we think all the cases that I've talked about, the 7 cases to date, acquired their infection off campus, due to the number of high-risk contacts within the residence itself on those 2 floors specifically, I felt that there was a risk of further spread in that environment, for which putting in place outbreak measures would be warranted. And so that's why I've declared an outbreak on those 2 floors. So it's not always black and white in terms of the exact numbers. However, if it's a situation where public health believes there is a risk of further spread, and it's important to put in place outbreak measures to limit that potential for spread, we can always declare an outbreak then, which is what we've done in this case.
And how many public health units
Yeah.
are you working with?
So that's a number that can vary depending on how many other areas the students may currently be residing in right now. So there has been some movement of students in and out of Waterloo Region. And as we find out about students who perhaps are no longer in the region, we will refer those cases or those contacts to the appropriate health unit where they are currently believed to be residing. So, that number will depend on where we think these students, if they're not here anymore, would have gone to, places where they would have gone to, sorry. But I expect with university students, they're not all going to be in Waterloo Region, and we will have a few health units to work with, for sure.
Given the restrictions the province announced on Friday, the modified stage 2 for hotspots, will you or have you extended a request for those same restrictions in Waterloo Region? And what would it take for you to make that request?
No, I haven't made that request because at this time, I don't feel that our situation is like those in Toronto, Ottawa, and Peel. But as I mentioned, similar to a number of other medium-sized regions outside of those three areas, we are in a precarious state, and our growth could accelerate rapidly right now, due to the good efforts of our residents. Our growth has not accelerated to that degree. It's been a relatively slow growth, but we are seeing a growth over time. And so we just need to continue to double down on those public health precautions and see if we can maintain that type of growth and, or rather maintain rates of infection so that they don't continue to grow, especially in an accelerated fashion.
Now, last week, you ordered the Section 22 for individuals who are not self-isolating after dealing with a number of individuals who aren't following the guidelines. What demographic or age group were these individuals in, and how many individuals were you dealing with to make you want to enact this order?
And there were a few individuals, and they were, they were in the adult age range, and I probably won't go into too many specifics about that, but from time to time, it becomes necessary when we feel that there is a significant risk to others, and we have tried other means to have the person comply, but they won't until they are made aware that they must. So I would say that it is not a specific age group only that is more likely to get these orders. We've had to issue orders to people in all age groups. And so it still remains, though, a very rare occurrence that we have to go to that degree of enforcement. But given that we have started in our wave 2, and in anticipation of the fact of the possibility that we may have a rapid number of cases come in, we want to ensure that we had the means to move as quickly as possible in the rare cases that it would be needed.
That's good. I'm good for now. Thank you.
Okay.
Thanks, Nicole. I'll go back to Damon if you're able to ask the rest of your questions now, Damon.
Hello, sorry about that. So I was wondering what the decision has been for rural testing, if there are plans to put centers out in these areas.
Yeah, I would also refer you back to Lee Fairclough. Because the testing, the assessment centers would, they would have the latest on that type of planning.
Okay, that's all. Thank you.
Thanks.
Okay, thanks, Damon. We'll move on to Joanna from the Record. Go ahead, Joanna.
Great, thank you. Dr. Wang, you mentioned that our numbers here aren't accelerating as quickly as, say, Toronto and other hotspots. Are you concerned that that's more a matter of numbers and that we will quickly catch up with these other areas?
Yeah, usually when we look at numbers, in order to make them apples to apples, provincially, they'll look at them using a standard metric, like the number of cases per 100,000 population per week. We haven't been accelerating the same way that other areas, Toronto, Peel, Ottawa, and now a couple of other areas like York have been accelerating. So we still have had a slower acceleration, which is good. And, I'm really thankful because I know there's a lot of residents that have been telling us, they are following the rules and they are trying their best. So as a region, we are making a lot of effort. We have to take a look at that type of growth. We also have to take a look at other factors like, how much the cases are bleeding into other age groups. We are seeing that happen in Toronto, Peel, Ottawa, for example. And right now we're seeing a little bit of that, and we're seeing a little bit of our hospitalizations creep up. But we're still not seeing a significant bleeding over into other age groups. That said, we have to be, very careful because as our cases go up, things like hospitalizations and then outbreaks in long-term care settings, they tend to be lagging indicators in that they tend to occur a little bit later. So you have an increase in the number of cases, for example, in a younger age group, and then 2 or 3 weeks later, you have hospitalizations and you have outbreaks in long-term cares that go up as a result of spread that's occurred between people of different age groups. So it's a bit of a lagging indicator, which is why we always have to, I think it's very important to, take a look at what's happening in the GTA and around us, because it just tells us where we could be easily going if we're not careful.
Okay, thank you. And then I have a couple questions for a colleague.
Sure.
So this is just regarding numbers in specific neighborhoods. And in the first wave, there was neighborhoods identified that were harder hit. And we're seeing now the numbers in the second wave that vulnerable neighborhoods are being hit even harder during the second wave. So neighborhoods where there's poor or Black residents congregated. And just wondering, given that public health had identified this back, in the summer, what have you guys done since then to try and reduce the rising case numbers in these particular vulnerable neighborhoods?
Yeah, in places like Toronto, where there's 3 million residents, they're mapping the cases, and we're continuing to map as well. And we're also working on putting in a feature for our mapping that will, if the reader would like it to be the case, to remove the influence of the first wave, because we know that the first wave was predominantly in long-term care homes in our region, as well as other places, but in particular in our region as well. So we've taken a look at that preliminarily, and we still don't have a whole lot of numbers to show as part of the second wave when we start to map it out, because we don't have the same type of population or numbers as Toronto. So we're taking a look at that, and when we think we'll have enough numbers per neighborhood, we will introduce that feature where you can remove the effects of the first wave. So we're monitoring that because we know it's a, it's a measure of interest that people are wanting to follow. So right now, to make a long story short, right now, we don't have enough data to show that yet, but we probably will soon. So we're looking into that. In terms of what we're doing, there's a couple of things. There's the longer term work that continues, and public health is a partner in that. We're a partner among others in terms of work on the determinants of health for those neighborhoods. So there's ongoing work on that, and we're continuing to participate in works in initiatives that have to do with trying to address determinants of health, such as the Wellbeing Waterloo initiatives and things like that. And in terms of potentially addressing any needs that may come up during the second wave with these neighborhoods, we have been in discussions with our testing partners about having plans in place should there be a need, for example, to put in more mobile testing in a specific neighborhood, because we're seeing a lot of growth in that neighborhood. In order for us to be able to enact that quickly if needed. So, that those kind of discussions have occurred, and there would be an ability if there was a need to bring in mobile testing for specific areas in the region. So right now, it's not something we're really identifying. But when there are situations that warrant it, then there would be those actions that would be put in place. So sometimes it happens. It's not only in neighborhoods, but it happens in different settings. So, for example, if there's an outbreak in a long-term care home, usually there's testing on site at the home, either by the home, or we bring in a mobile team. So it's an example of where a mobile team is dispatched to do testing. And we can see that also, for certain outbreaks. For example, at Wilfrid Laurier, if there's for the residents, that's also an option that we're putting in place, so that the students at the residence can be tested on site. So when we have a setting where there may need to be some testing on site, then that's when the assessment center's mobile teams can be activated to perform that testing.
You mentioned the mobile testing that could perhaps be implemented, but given that you acknowledged back in the summer that there were neighborhoods that were seeing more cases, why were these interventions not already put in place to prevent things from becoming worse during the second wave? Like, was this not a kind of a priority, given that you knew that certain areas and people were more vulnerable?
I think one of the things to be aware of is that our correlations with certain neighborhoods were not strong. It wasn't similar to it wasn't the same thing as what we're seeing in Ontario. I think we have testing available for residents across the region via the various testing centers. And I think we have to, there's a couple of things. So we have to continue our work on the determinants of health to get at the longer term issues that might put these neighborhoods at greater risk, not only for COVID, for other things. So it's not that we're waiting for proof that these neighborhoods need, we need to continue to work with them. And it's a kind of community initiative. It's where a number of partners are working together to try to address some of the determinants of health in these neighborhoods. But in terms of specific initiatives for COVID, we don't have that type of correlation that says right now there is a need to prioritize the testing resources that we have in our region to a specific neighborhood or neighborhoods versus allowing the testing to be like versus the testing plan that's in place for our region. But if there is identified a particular need for a neighborhood, then there's mobile resources that can be dispatched to go into a particular area where we're seeing a higher rate of infections in that neighborhood, for instance. So, yeah, seeing if there's a better way for me to phrase that. But
I guess just generally, are you happy with how public health has responded to make sure that certain neighborhoods aren't, bearing like a sort of undue burden of this illness?
Yeah, I think, what I think we've identified is that, these are broad societal factors. And, we need to continue to do work in these areas as a community, right? Public health is one of the partners among many that can actually impact the social determinants of health because they relate to factors such as income and employment and things like that. And so, we continue to work with other partners regarding the social determinants of health. And we do know, for example, we have programming called peer programming in some of these neighborhoods that we began to work with before COVID. And, we'll continue to work with as part, even during this pandemic. And there's, we're part of initiatives like Wellbeing Waterloo and other initiatives that address the social determinants of health. I think in terms of COVID and the focus on, there are specific neighborhoods right now that are experiencing, like we see that in Toronto. And I think what we need to do is continue to monitor locally to see if that situation does appear in our region. And if it does, then we would have mobile teams for the more immediate needs of testing be able to be dispatched as needed to try to, improve accessibility if we are finding that accessibility, for example, is an issue. So we have to tailor the interventions to what we're actually seeing, So we're not really hearing right now, people are saying, I can't get to an assessment center, and that there's an area in our region where there's a high rate of infections and people are not able to access testing, for example. So we're not really seeing that right now. But if that should happen, and that could happen, so we have to monitor closely, then that's when measures like, a mobile testing team could be dispatched to go in and assist.
Okay, thank you. Those are my questions for now.
Thanks, Joanna. We'll move on to Ben from 570. Go ahead, Ben.
Good morning. Hope you're doing well. This question is kind of in the similar vein of what Joanna was just talking about. For low income areas, for example, or maybe not even necessarily, there are some people commenting on the message to stay home if you're sick. They're saying, obviously, that doesn't really work for people who don't get paid sick days. And until the national paid sick leave rolls out from the Liberal government, that is a fair point. What is your messaging around that?
Yeah, that's a very good question, Ben. Yeah, no, those are examples of the types of barriers that people can face if they don't have as much paid sick leave, or they're in more precarious employment situations. So I would say, I would ask that employers please try to be as flexible as they can with their employees. That they work to give the employees the time off that they need, because it's important that we all work together to try and prevent people who are sick from working, because that will increase our risk of spread. And, that will lead to further potential restrictions for regions. So yeah, it's a very challenging situation. If people don't all have access to the same number of sick days and things like that.
Okay, thank you. The Ontario government is asking residents not to leave the house unless it's essential, kind of seeing, obviously we're not seeing the same numbers as Ottawa, Toronto, and Peel, but places like malls, for example, are open. Do you back the messaging that we should only leave for essential shopping, or are we okay in the region to keep visiting non-essential places?
Oh, thanks for the question, Ben. The Chief Medical Officer of Ontario made that recommendation for all of Ontario. So I do support that people consider, limiting their outings to outings that they feel are important and essential. We are seeing escalating growth in other areas, and we are seeing areas like ourselves, other medium-sized regions like ourselves, be very vulnerable to rapid escalations. And so I think, people should, in general, heed the advice that's being given by the Chief Medical Officer of Ontario in terms of limiting their outings to ones that they feel are important or essential.
Right. Now, when it comes to areas, for example, like shopping malls where people are closed in, are we just kind of putting the message out there, please only make your trips essential? Or would there come a point where you would close those because you've said we are in a precarious situation and vulnerable to a spike in cases?
Yes. So we're not at the point where we would recommend, or I would recommend for the region, that we put in further restrictions to businesses at this time. I'm hoping that we can continue as a region to work together to slow the spread, and that closures will not be necessary. So that's my hope. But at the same time, we'll continue to monitor, and the advice over time could change. Hopefully not, but at this time, no, I'm not recommending any further restrictions on businesses.
Okay, just a quick question about the Laurier outbreak. Were there any staff exposed in that case?
Their staff exposures, well, that's something, we're looking into all the context of the cases right now. So at this point in time, I don't have additional confirmed or probable cases among staff.
Okay, that's all my questions for now.
Thank you, Ben. We'll go to Linny at CBC. Go ahead, Linny.
Hi. I see I'm not the only one with a bike in the background. I have as well. My first question, when students test positive or have tested positive in residence at Western University in London, they've been sent to an off-campus location to isolate. My understanding from what's happening at Laurier is that those students are still in their residence. So why was the choice made to keep them in their residence?
So that the university is actually taking care of moving students to isolation spaces. They have those. And so they would be able to respond to your question, but our understanding is that students are being moved to isolation settings if there are cases and need to be isolated.
Okay, thank you. So what does the other member or the other individuals who are on those 2 floors that you mentioned, you said that they're self-isolating, and I wonder what that looks like for them. Does that mean they can interact with other people on the floor? How are they getting food?
And no, they're to stay in their rooms and self-isolate in their rooms, and the university is arranging for food for them. Yeah, I
My
would
experience
I
in
would suggest
residence was bad enough.
Yeah.
I can't imagine having to have COVID and quarantine in residence as well.
Yes.
Sorry, you were saying
challenging.
something else.
Yes, I think the university would have more information for you about how they are, supporting the needs of those students who have to remain isolated in that residence. I know they have a plan for that and are acting on that plan now.
And this might be a little bit premature, but do you have a sense of how Waterloo Region did over the long weekend in terms of listening to public health advice? And if you do have a sense of how we did, how did we do?
We don't have a sense of that right now. We're probably going to see the answer to that question in about 10, 14 days.
Do you have a feeling about it?
Well, I've been told that the streets have been quieter. I think that may have been, partially due to not only the messaging around Thanksgiving about, keeping to your immediate family household for the celebrations, but also the advice about, in general, sticking to your immediate household and, only going out when, or limiting the times you go out to when it's essential or important. So, I have just noticed anecdotally there's less people interacting outside. But the true test will come when we see our numbers in about 10, 14, 21 days.
Thank you.
Yeah.
Is that it, Lenny?
Yeah.
Okay, so we've gone around the room once. Does anyone have any follow-up questions? Oh, I see a few. Okay, we'll start with Ben from 570.
Thanks very much. I just wanted to stick to my limit of 3 last time. I do have this is a kind of a follow-up question to when we were talking about Section 22, Dr. Wong. Do you have the specific number of people who you had to issue an order to under Section 22 before the class order?
Yeah, I do. I'm just a little concerned because it's a small number. I would say that there were a few individuals, and that I've had to issue an order to during this pandemic, and they've all been since September, since the second wave. Yeah, I'd probably say there's a few individuals.
Okay, I guess I would ask then. Obviously,
less than
I'm
five.
kind of
Less than 5.
sorry.
Less
than five.
Yeah.
Okay. So what is the difference then between issuing a class order of Section 22 versus having to reissue it every time? Like what does this allow you to do, and what would be the reason for issuing it as a class order if it's so rare that you have to use it?
Yeah, no, that's a good question. For individual orders, you need to generally tailor the order to the specific situation. And so it just takes more time because you have to get the specific details in a specific, you have to get the specific details of the specific situation down, and then you have to make sure the order is delivered to the person. So there's some, there's that extra time versus a class order when it's basically been delivered to everyone. It includes all the various situations for which we would move to enforcement of the order if needed. So it is something, hopefully it will continue to be a rare occurrence, but with the rising number of cases, I felt that it was important to make sure that should we need to act, we could do so as quickly as possible.
And as far as that acting goes, I'm wondering how many warnings does someone get? I know you mentioned that it's specifically only for the people who are not following, purposefully disobeying. How many warnings do they get before it becomes a requirement? And what kind of like legal enforcement is actually in place to make that requirement necessary?
Yeah, so there's not necessarily a specific number of warnings, but what it is it's the overall picture. So we try very hard to work with individuals. You know, if we think it's a question of not understanding or a question of there's something that's making them feel like they can't do it, we try to work with them, of course. We try to use non-coercive means as much as possible. Coercive means are a last resort. But, you know, it could be that a person has been warned, but, you know, they continue to say, well, no, I won't be doing that. And then they actually go out and put other people at risk. And in that case, you know, we'll act faster, like we'll work. It's a judgment call. And you know, these cases are always reviewed one by one. The case investigators and, you know, one of the medical officers. And usually, you know, myself, I'm always included in these just to, you know, make sure we feel that an order is what we need to do. So it depends. Yeah, it depends on, it's not a specific number of warnings. It depends on the overall situation. And the principles are, you know, we feel like this is a significant risk. And number two, you know, we've tried, but there isn't another way to get this person to comply. And so in terms of your follow-up question, I'm sorry, I think there's noise outside my house, a lot of lawn mowing going on. In terms of enforcement, well, we can then proceed to taking the person to court, or we can levy a charge. So, you know, our objective is always to get the person to comply, but those are the couple of options that would be available to us.
In the case of taking them to court, what would that involve? Would that just be another sort of charge, or?
It would be you know, asking a judge to enforce it. And so it would be another means of enforcement. You know, having a judge, having the court order the actions on the individual as well.
Thank you very much.
Thanks, Ben. We'll go to Nicole from CTV. Go ahead, Nicole.
Hi, getting back to the WLU situation, how many study groups, can you quantify how many study groups were linked to the 7 cases?
We can't quantify that at this time. We know there were multiple study groups. So, you know, our investigators are looking into that at this time. We may never know specifically the exact number, but the reason I wanted to mention it today is because I wanted people to understand there has been spread in these study groups, in-person study groups, and really, you know, I don't recommend that people gather if they don't have to, and that you know, the safest way to study together is to study virtually.
So when you have these 7 cases, are you able to say how many other high-risk contacts there were, if there were multiple groups?
Yeah, at this time, that number is very fluid because, you know, our case investigators are following up with cases right now. So they're identifying high-risk contacts as we speak. We know for the residents that we are considering those 2 floors as being an outbreak. So those people on those 2 floors will need to be all considered as high-risk contacts for now. And in the study groups, It will depend on, how many contacts we identify, not only who are part of the group, but who, through our case investigators, have been determined to have what's called high-risk contact. So the number will fluctuate, or the number is, I don't have an exact number at this time, but yeah, it will depend on what we find through our contact investigation.
I'm just wondering, about a week and a half ago, the province released its modeling projections for mid-October. Wondering if there are any local modeling projections that you guys have been working on.
Yeah, we only have the same data as you have. We got the PDF slide deck that you guys had that was sent out to the press. So if you look at that, what they modeled at that time, which was before their latest restrictions were put in, they modeled about 1,000 cases in quote unquote mid-October. So 1,000 cases a day in Ontario in mid-October-ish. So if you take that number and you take a look at the proportion of the Ontario population that residents in Waterloo Region represent, that's about 4%. So you'd be looking at 40 cases a day in mid-October-ish for Waterloo Region, just based on the population numbers. So that's basically all we can do with the data that we got, is to make that extrapolation based on our population rates. Our population size.
And final question, not sure if you saw, there was a major super spreader event from a spin class in Hamilton. One case led to 51 cases, and there potentially could be more. Are you keeping an eye on that, and potentially perhaps making a request to shut down gyms or spin classes here in the area based on what's happened to Hamilton, considering it's very similar geographically and demographically?
Yes, so we've had one outbreak in a fitness facility. It was a relatively small one, but it was still an outbreak, and obviously the one that is occurring right now in Hamilton is concerning, and we are always keeping an eye. So every time we have a case, most cases go to work or go to school or visit facilities, and so we are always tracking down places they could have acquired the infection at, or places they could be spreading the infection at. So it's following all these various settings, and dozens and dozens of workplaces that we've followed up on. And so we haven't seen other outbreaks to date in our fitness facilities in the region, but it is something that obviously, as the evidence starts to come in, we have to look at. So I know that's being looked at provincially, because they would have even more evidence. So there are other outbreaks in the province in various settings, and so they would have the cumulative picture of all the different settings that would fall into the fitness gym category, and seeing how it's being spread there, what are the risk factors. So we'll just have to see where the evidence takes us for these settings, but right now I don't have any further recommendations for those settings.
Okay, that's it for now. Thank you.
Thanks, Nicole. And I saw that Joanna had her hand up. Do you still have a question, Joanna?
Yeah, just back to Halloween. You gave some tips for safer trick-or-treating, but would you prefer that nobody trick-or-treats this Halloween? And also, will there be any sort of special enforcement or like increased officers out on Halloween, kind of trying to prevent situations that might spread COVID?
Oh, I think everyone's frozen.
Can you hear us now, Hsiu-Li? you're back.
Sorry, I think I froze up because everybody froze up for me. So yeah, I think I froze up. So my recommendation would be that we don't do activities that we don't find are important or essential, in line with what's been recommended by the Chief Medical Officer of Ontario. Now that said, I don't have an ability to enact, to proclaim whether or not Halloween, people can, do Halloween or not. What I am recommending is that, that people, I would like them to consider lower risk activities. And I would like them as much as possible to do activities only within their immediate household, or if they have a very small group of friends, to do it, outdoors, well physically distanced from each other. But people will make their own decisions, and unless there is a particular things could change, right? Pending from now until Halloween, I may make stronger recommendations, but at this time, I'm asking people to consider lower risk activities only, and if they choose to participate, in things like trick-or-treating, there's advice that we've given in public health to reduce the risk as much as possible if they choose to go out and do that.
Okay, thank you.
Thanks, Joanna. Are there any other questions? Okay, I'm not seeing any more hands up, so we'll conclude today's media briefing, and we want to thank all of you for joining us today. And just a reminder that we are going to add a second briefing this week. It'll be Friday, October 16th at 11:30. We'll send you out details later this week, and hopefully we'll see you all there. Take care and have a good day.